Hi, I'm Dr. Nikila, Consultant Obstetrician and Gynaecologist from KIMS Cuddle, Secunderabad. So today we want to discuss about breastfeeding and what is its importance. As we all know that breastfeeding is very essential for the growth of an infant, and it is very important to initiate breastfeeding immediately post-delivery because a breast milk contains lot of nutrients, antibodies, which helps in the growth of an infant, enhances immunity and reduces the infection rate. It also helps the mother in decreasing the postpartum bleeding, and it also builds a unique bonding between the mother and the child. So a few questions have been raised by a lot of patients about breastfeeding, so which I want to know it from our lactation specialist Pooja Marathe. Hi Pooja.
Hi Dr. Nikila.
How are you doing?
I'm doing great.
Okay.
How are you?
I'm fine. So shall I ask you the questions what I have got from a lot of patients?
Great. It will be lovely to explore because this is such a hidden topic.
Yes.
Many people think it's a taboo.
Correct.
And they don't speak up openly. So there are many patient queries.
Yeah.
I would love to answer them.
Sure. Okay. So let us start with our first question. Why is breastfeeding considered crucial for an infant's early development?
Right. So this is a very important question, Dr. Nikila.
Okay.
As we all know that the government policy, 1000 days of nourish, which includes 270 days of pregnancy and 780 days of post delivery.
Mm-hmm.
In this, the government has set guidelines on to giving mothers the benefit of starting early breastfeeding for their child.
Okay.
Now these benefits, we can understand it from the mother's perspective and from the infant's perspective.
Okay.
As you already mentioned, from mother's perspective, it controls the postpartum
Yes.
bleeding, it enhances the bonding, it helps the mother to come out, lower the stress. From the infant point of view,
Okay.
the infant is able to get, more of nutrients, the growth is going to happen properly, the weight gain is going to happen properly. So these are the benefits of doing early breastfeeding. Also, we need to understand that we follow a policy of early initiation, or what is known as the golden hour. So within 1 hour of delivery, it is ensured that the pediatrician as well as the lactation consultant ensure that the baby is latched to the mother's breast wherever the mode of delivery has happened. So this allows the mother and the baby bonding to be much better.
Okay. So what nutritional benefits does a breast milk provide that are essential for a baby's growth?
Right. So when we talk about mother's nutrition, we are always talking about protein, carbohydrates, fiber, water intake. But when we are talking about infant nutrition, it is rightly suggested by the UNICEF and the WHO that the first 6 months the baby has to be exclusively breastfed. That means whatever nutrition is going to the infant will be going through the mother. So the proteins, the immunoglobulins, the calories, all going to the baby will be coming from the mother's diet. And if the baby is early breastfed, the first 3 days is very crucial to understand, which is why we call it as golden period. And the first 3 days we have colostrum, which is golden in color or liquid in color, and people might think it is not good, but it should be given, and that is what is enhancing the immunity power.
Okay.
So this colostrum changes to transparent color milk, and by the 5th day it will be full color white color milk. Slowly these transitions will allow the baby's weight gain to happen. Baby will be put on full feeds, which is mother feeds, exclusively breastfed. Over here the outcome is happy baby, happy mother, and smiling faces of all the parents.
That's what we need. How does breastfeeding contribute to the establishment of a strong immune system in newborns?
Right. As I explained that when we start with early initiation, and in the hospital we are having a privilege that every hospital is now having a lactation consultant.
Okay.
So as soon as she knows that a newborn is born, she will help the mother, she will settle the mother, and she will address the breastfeeding concerns. It could be positioning, it could be feeding, it could be the question, the doubt that the mother has milk rawat ledu, or the milk is not coming, it is very few. The lactation consultant makes it a point that she visits and she counsels the mother, she counsels the entire family. every time the mother is initiating breastfeed, the effort has to be applauded. So this lowers the stress. In return, the milk production also enhances. We also call something known as skin to skin. Baby is kept to the chest, on bare chest. The baby is also doing tummy time with the mother while breastfeeding. So these are beautiful things which enhances breastfeeding, and it is established at the time of discharge. So when the baby is getting discharged from the hospital, we ensure that the mother is exclusively breastfeeding, and if she has any concerns, she can come back to us in the OPD.
In what ways does early breastfeeding foster the bonding between the mother and her baby?
Right. In the first question, which was, the major concern of understanding the benefits of breastfeeding, this bonding is allowing the mother to calm down, this allowing the baby to have support from the mother. The baby's cry is a communication method to the mother. So the mother can understand whether it's a hunger cry, whether it's some indication for anything else. It could be a diaper change, or I am feeling uncomfortable, or I am not comfortable in this environment. So a cry or a communication is by the mother. But breastfeeding enhances good connection between the mother and the baby. Number one, the IQ level, the cognitive skills, all these skills are developed. Number two, the mother is not emotionally stressed. Number four, the mother is more motivated to continue breastfeeding as long as she wishes. There are no norms in the society that you have to stop after 6 months, after 1 year, after 2 years. Many people in the society say many things, but as long as the mother is comfortable, even if she is returning back to work, she can continue breastfeeding, because WHO guidelines say that cognitive development of the child happens within the age of 1 to 2 years. So when these are the emotional benefits are understood by the mother, she can definitely take a chance and continue breastfeeding till the time she is comfortable.
So how long do you think that the mother should breastfeed the baby?
So ideally,
Because when we should, because they come and ask like whether we can start weaning off and all, they also need other proteins and nutrients from the food. So what kind of food we can provide the babies if they start the weaning?
right. So when we talk about breastfeeding, it is 6 months exclusive breastfeeding. But when we start about complementary feeding, which we start from the 6th month to the 24th month. Now let me explain you this term complementary. It is an additional food. So with breastfeeding, we are introducing traditional foods which are safe, which are homemade, and which can be digested easily by the baby. So when we are starting 6 months food, it has to be that the breastfeeding is continued, plus introducing small items like khichdi, upma, soft semi-solid foods. It could be vegetable purees, it could be mashed fruits. They need not be boiled. So there are misconceptions, that if you give pureed apple which is boiled, or a boiled pear, but in order you are losing the nutrition. Right? So we need to understand that few foods along with good amount of water will help the baby to have a good weight gain. The cognitive skills will be developed, the gross motor skills are going to be developed, the baby is going to crawl, stand, have his amazing activities. Baby is not going to get constipated, weight gain is going to be proper. So till the age of 24 months, it is that complementary food is to be concentrated. No sugar and no salt to be introduced till the age of 2 years. And this will allow the baby to accept all kinds of food. And also when we understand, the mother can continue breastfeeding beyond 2 years. So that is why comprehensively say first 1000 days of life is known as nourishment. So 9 months in the womb and post that 730 days in the outside world. The child gets accustomed to our health living. And what are we doing is, we are investing in the child's health, because the future will be bright. The child will not have any thyroid, any diabetes, any kind of health allergies, or any other health discrepancies, because the child has been exclusively breastfed. That is my take, Dr. Nikila.
Thank you, Pooja, for your valuable information about exclusive breastfeeding for a newborn. Then, when are we going to have our next session?
Yeah, so please stay tuned because we are coming up with a series of these topics for infant food and nutrition. Our next session will be definitely complementary feeding, and if you have any questions, you can post to us on our YouTube channel. We will take them during our session, so it will address your queries and your concerns. Stay tuned to listen from us. Thank you so much.
Thank you.